I refer patients to self-management classes because being amongst peers who may share common conditions really makes folks feel like they aren't alone. I think having that peer-led group really takes some of the pressure off.
As a dietitian, I work with a variety of different patients, helping them to better meet their health and wellness goals, and sometimes that can be linked to managing different chronic conditions. Access to a variety of information will help these individuals better manage their condition.
We have a cadre of self-management programs, from a tobacco cessation, living with diabetes, living with chronic pain.
I had my left knee worked on 40 years ago, so consequently I have arthritis in that knee. I was working at a preschool and I loved it, but I found that my condition was making it really difficult for me to be comfortable. And that's when I realized that my chronic pain was really affecting me as a whole.
Being in a class of other people who had chronic conditions, I felt less alone. I was encouraged by their stories, and hopefully I may have encouraged one of them. The community, that was probably the most important thing for me.
We know that just talking to a patient to say you have to lose weight, quit smoking, exercise, really doesn't do a lot. Through the programs, patients internalize why that's so important for them, and then they, activate themselves.
It's not doctor-led, so it's not, you must do this.
I wouldn't have done it at home. You give me that book and sent me home with it and said, hey, read this, take care of yourself, I wouldn't do it. But because there were other people there, we all got to know each other and cared about each other, it helped me realize I can care enough about myself to do this. And I think that's really hard for a lot of people.
Sometimes if somebody else has figured out a way to do something, you can adopt it easier.
Having that classroom situation, having people in there that were working on the same ideas that I was working on really helped me grow.
These classes are really helping them to better manage their chronic conditions without relying on multiple visits with their provider.
They are doing things with patients that we really don't have time to do in our offices in the midst of a busy day.
All the programs offer some basic tenets of self-care: the role of physical activity, the role of healthy eating, mindful meditation.
Chronic pain is just that. It never goes away. But we were given tools. One of the things was learning how to breathe. The tools, they don't all work for everybody, but when you find something that does work, hang on to it.
The skills that patients learn can apply to many facets of their life. There's no downside. Every patient benefits in some way, shape, or form.
The Healthier Living workshops help to create a better connection between the provider and the participant. At the end of each program, a letter is sent to the provider saying really what they've accomplished. It also talks a little bit about the action plans that they've developed.
Going into the class, I didn't know what to expect. I went in with an open mind, an open heart, and open hands to find answers, and I did. I'm no longer on opiates at all, period.
I think there's a sense of pride after you've gone through something like that you want to come back and say, hey doc, I did this. It's a sense of accomplishment. Part of the self-management class is gauging readiness to change, knowing why you want to make that change, how you're going to sustain that change, and what you're going to do when you meet those barriers. If you can engage the patient and get them motivated to do this for them, those skills will stick.